Cotton, and this is my papa, Christopher Cotton, and my mama, Woman Cotton. My papa is my mama's caretaker. She is blind and in a wheelchair. We thank God for my papa's insurance because he's a veteran. One day we were strolling when all of a sudden, somebody call 911. Papa, you're okay. You're in the hospital.
Because of your heart attack, we're going to do some assessments on you to make sure everything's okay so that when the doctor sees you, he can prescribe appropriate medications. Is that okay?
Yes.
Okay, perfect. Okay, so first I'm going to take your temperature. Say ah. Under your tongue, close the mouth. I'm going to take your blood pressure now. Are you feeling dizzy, lightheadedness?
No.
Are you on any medication?
I take aspirin every day.
Okay, let's take your blood pressure. Well, your blood pressure is a little higher because you had a heart attack. And now I'm going to take some blood for your lipid panel to see what's going on there. Okay?
Hi, Mr. Cotton. I'll be your doctor. My name is Dr. Pepper. And we got your results back. And your HDLs, which is your good cholesterol, is low, it's 40. And your bad cholesterols, which are your LDLs, it's 192. So you have high cholesterol, and I think that's mainly because of your diet. And it's because of that you had a heart attack. So I'm going to be putting you on Lipitor, and you're going to be taking 40 milligrams orally every day. The Lipitor is going to help you control your cholesterol. I'm going to be taking you off of aspirin and putting you on Plavix instead. You're going to be taking 75 milligrams orally every day. And the Plavix is going to help prevent any further clots, so you can prevent any more heart attacks. These drugs are going to cause you to have increased bleeding risks. So you're going to have to be cautious about anything that might cause bleeding. And also you'd want to make sure that you don't have any blood in your stool or urine. If you see any blood, then give me a call. And also if you use the straight razors, switch to electric razors, that will reduce your risk for any bleeding. And use a soft toothbrush when you're brushing your teeth.
Christopher, I told you not to get that Wendy's and Krispy Kreme yesterday. Did you even listen to what that doctor just said?
Papa, give me that. Didn't you hear what the doctor just said?
No.
Maybe we should call a nurse.
Okay, Mr. Cotton, I have to explain to you. You first had a heart attack. Do you know that?
Yes.
You had a blockage in your arteries due to the high levels of cholesterol. The doctor prescribed Lipitor. This will increase your HDL or your good cholesterol and decrease your LDL or bad cholesterol. Do you understand?
Yes.
Some side effects. You may have will be some abdominal cramps, flatulence or gas, heartburn, constipation, or skin rashes. However, the most serious side effect is rhabdomyolysis.
Oh,
Which
what's
will-
that?
Oh, it will hurt your skeletal muscle and will leak toxic material into your blood.
Yeah. So what do I need to change?
Mr. Cotton, you're going to need a low-fat, low-cholesterol diet and moderate exercise. Moderate exercise is about 15 to 30 minutes a day. That means no more fast food. Oh, no. What is that?
Okay, Mr. Cotton, while you're taking Lipitor, you should avoid alcohol, any kind of alcohol, like what you are drinking just right now, and grapefruit. Grapefruit and grapefruit juice, no, not good. You must take it at night
The
before
medicine.
bed. The medicine,
Lipitor.
not the alcohol. Call the doctor for any muscle pain, any. Follow up to check cholesterol levels, Remember that this medication will take about 6 to 8 weeks.
What about the other drugs?
Well, what other drugs? The Plavix?
Yes.
Okay, well, you can't have this one with alcohol either, but this drug is used to prevent future heart attacks and clot formation. Well, the main side effects are bleeding, dizziness, confusion, GI, gastrointestinal bleed, nausea, and vomiting. So you must take this with food, but not burgers, healthy food. You may have lower platelets, which may lead to a fever and infection, but you need to tell your doctor right away if this happens. Okay, with this medicine, you need to take it as directed so you don't have another heart attack, stroke, or clot. With this medicine, you need to take bleeding precautions, which includes a soft toothbrush, no flossing, and using an electric razors. Plavix may have an increased risk for bleeding, so you will want to have to check your poop after you wipe for blood. You could look at the tissue, or you could look at that in the toilet, or if you want to poop in a jar and bring it to your local doctor.
How are you, Mr. Cotton?
I'm fine.
Well, your HNH and your platelet levels are within normal range. Normal. Your vitals are also within normal range. That's very good. Where do you get your prescription filled?
CVS, why?
Well, if you have any questions about your meds, your pharmacist is a good resource. If you go to Florida Hospital website, Heartland and Cardiac Rehabilitation website, you can find a professional support group for CV support group and sign up. It helps to provide more info about your drugs and your peers going through the same things. The best resource available is to contact your cardiovascular specialist, who can answer questions about your meds and how they are reacting to your body. A great group of cardiovascular specialists are located at the Florida Heart Group. Then this is owned by Florida Hospital with 3 locations, Altamonte, Orlando, Oviedo, and you can call and make an appointment. Their information is located at the www.fhg.org.
So, Florida Hospital believes in this model called Creation Health Model. It allows you to live a healthy, holistic life. Acronym CREATION, which spells creation. The C is for choice. So you need to start making healthier choices, like instead of eating Krispy Kreme, maybe a salad, and making the choice to take your medicine as prescribed. R stands for rest. You need to get adequate amount of rest. Wake up, sir. Yes, I know you need rest, but this is very important. So 7 to 8 hours a night would be very beneficial. And at night, that's when you usually take your Lipitor for your cholesterol. So that's good. And the E stands for environment. To have a calm, serene environment that relaxes you.
You should get this woman out of here then.
Peter.
The
The A stands for activity. So, remember we discussed getting a little exercise a day, 15 to 30 minutes?
Mm-hmm.
Yes, we need to be a little more active. Maybe go for a stroll in the park.
That didn't work out so well.
Oh. Or just around your backyard or down your street. The O stands for outlook. You look like a very pleasant man. Keep up your positive attitude and turn that frown upside down. Come on now, smile. Okay. The N is our biggest concern for you. It's nutrition. You need to improve your nutrition. It's not a joke. So, eating healthier food choices such as salads, lowering your meat intake would be good for your heart as well. Cutting down carbohydrates, eating more fruits and veggies. We can't emphasize that enough. And since we also are nutritionists, you're always free to give us a call to help plan your diet.
Yes, we'd love to answer any questions that you have.
Yes. So everything looks good, and the doctor said you're good to go home for discharge.
Christopher, can you get me a glass of water?
Of course.
Thank you, dear.
Papa, what happened? Are you okay?
Candy, what's going on?
Hi, Mr. Cotton. Nice to see you again. How are you feeling?
I've been okay.
Okay, what's your pain level like?
Probably 3 out of 10.
Okay, that's not too bad. I'm going to put you on ibuprofen. The ibuprofen is going to stop the prostaglandin synthesis in your body. That basically just means that it's going to help reduce your pain. You had the fall because with your previous the meds that you're on right now, they cause something called orthostatic hypotension. That means that when you move from a sitting position or a lying position to standing up very quickly, you get lightheaded, you get like a momentary hypertension, and that's why you fall. So from now on, if you're sitting, you want to come sitting and remain sitting for a little while, orient yourself, and then stand up, okay? Okay, with the ibuprofen, you're going to be taking 2 tablets as needed for your pain throughout the day, but do not exceed 6 tablets for 24 hours. And take your ibuprofen with food or milk. That will help to reduce any stomach pain or injury from the ibuprofen. And you should be extra cautious about bleeding risk because the ibuprofen is going to increase your bleeding risk more. So everything you learned about reducing those risk factors, like using your electric razors and stuff like that, make sure you keep on that. And if you see any blood at all in your stool or urine or anything like that, give us a call. You can have this information. I'll get you a copy of it. And that's it for this. Do you have any questions?
No. Thank you.
Some potential barriers to medical compliance for Mr. Cotton are: number 1, a financial constraint is one barrier to medication compliance because the patient cannot afford the meds. The Cottons are a low-income family, which makes this barrier relevant. This barrier is overcome by his veterans insurance that covers his meds. Number 2, another barrier is that the patient may not understand what his meds are for or how he's supposed to take them because of inadequate health literacy. To overcome this barrier, we explain what his meds are for in layman's terms along with the written information so he can look over afterwards if he forgets.